Welcome back to Between Two White Coats, a podcast designed to help you be the healthiest version of yourself. I'm Dr. Michelle Plaster, a family medicine doctor.
And I'm her co-host, Amber Foster, a family nurse practitioner. In our combined 30 years in medicine, we've seen a lot.
We're discussing key issues surrounding health and wellness, answering some of our biggest questions, overcoming health obstacles, and giving patient-centered advice in hopes of educating you and providing the tools you need to live a healthy life.
If you find our podcast helpful, please consider subscribing so you don't miss an episode. And don't forget to leave us a 5-star rating and review. This will help other people find our podcast.
Thanks for joining us. We look forward to serving you. Welcome back to Between Two White Coats. Thank you so much for joining us. Amber and I are going to talk about something today that we could talk about forever.
Which would honestly make you kind of wonder why we're wearing white coats if we can talk about this forever.
Yes, our broken healthcare system, our country's broken healthcare system. In preparation for this, really the preparation for this is our life, but in preparation for this, I Google broken healthcare system and get like flooded with people begging, writing wonderful articles out of Harvard, out of NIH, everywhere, begging for people to pay attention to the fact that our healthcare system is very broken. And I don't know if it's common knowledge. I'm saying things to patients these days that they look more surprised than what I think they should. Patients will say, it's taken me 4 weeks to get in to an orthopedic where it used to take me 4 days. And I'm like, well, a lot of doctors and nurses left the healthcare system during the pandemic. Yeah. So we can't get people in places.
Well,
there's just so many things.
Yeah, and I think sometimes too, like when things are broken, and I say this about when patients feel bad, I'm like, you don't realize how good you feel until you feel good.
Yeah.
And so like we just have kind of come to expect that, well, we're going to have an issue anytime we have to write a prescription or make an appointment or try to get something completed for your, like get a scan or something. And so you just expect there to be a problem. Like it doesn't ever seem to go smoothly.
You're
so
exactly
I think
right.
that
we've normalized how ridiculous it is.
Yeah. We've just normalized the bad. And so, and I don't know that it's ever really been great, but I feel like it has just progressively gotten worse. And from our standpoint, like it breaks my heart for patients.
Yeah. Like
over and over again, it's not, we're all suffering because we're all patients.
Yes.
But the people that are sitting in front of us, I'm just like, oh my goodness. Oh, we can't fix it. The two of us, I will try because my personality. I will go guns a-blazing trying to help, but the two of us just can't do it. Like it has to be a collective effect.
Yes. So as you say, it breaks your heart. Yesterday, yesterday, this happens probably every time we see patients. I'm sitting with a patient who's 60, and she has COPD, and she has no insurance. Her COPD is at the point that she can't work, and so she lost.
This patient. I know who you're talking about.
She lost her insurance at work. Yes, because she can't work. She did not qualify for disability, and she can't get on. She's 60. She's 63 because I remember thinking, I can't keep you alive 2 years to get on Medicare. I don't think this woman will be alive in even 1 year. And she is trying to purchase oxygen on her own,
which is not cheap.
No, and is even hard to access.
Yeah.
Like how do you even go about getting it?
Yeah.
She's waking up in the middle of the night with her oxygen levels at critical levels because she's trying to ration the oxygen and not wear it all the time because she has to stretch it so far financially. And she's showing me there's so much going wrong. And then she shows me the spot on her leg that really needs biopsied. And I'm thinking, how are we going to get that biopsied? This could be a melanoma or something, but how are we going to get that biopsied? And it's like the whole visit, I just thought the barriers to getting her the help she needs are so big. And I make a note on the bottom of my note to the billing team saying, hey, I'll see her for free. We're going to need to put money toward her inhalers and other things. We're calling the pharmaceutical companies, trying to get her samples. But it is a huge mountain this poor woman's climbing. She has no assistance. Yeah. She's trying everything.
And without violating your HIPAA, I know who you're speaking of. She doesn't have a big family support system either. So you're having, I'm sure she feels isolated and like.
And she's working hard to navigate it.
Yeah.
And is well versed, but every time she learns more obstacles.
Yeah.
So it is. So there's a million things we could list off for what frustrates us and what we feel is broken in our healthcare system. But if you changed one thing, what would be the one thing that would stand out to you? It's so hard to choose.
It's so hard
just
to
one.
choose one. Which Shelly and I were kind of talking a little bit before we pushed play, but I don't think people realize the value of primary care. And so, like, if that's the one thing that I could just be like, hey, you need a good primary care. It doesn't have to be us, but like to find someone that you trust, that you have a good rapport with, like you mentioned, like this patient is self-pay. We have the ability to say, we will see her for free because we know that like we value her life. She has been our patient for a very long time. And like we would rather care for her well,
and help her
and
navigate
help
the
her.
system because we at least understand a little bit more about it.
And also, like, where she's not going to urgent care and she's not going to ER every time she needs something, that she's coming to us.
Yeah.
And so, I mean, I kind of joke that our name is Our Family Health, but I really feel like that kind of needs to be, like, if we see everybody as, I tell my medical assistants, I tell my students that come in, like, you treat this person like it's your grandmother, like it's your dad, like it's your cousin, like it's your sister. It makes a difference. And so I feel like if I could do like one thing from a medical community standpoint is make people care a whole lot more. And I don't know that I don't know that you can teach people that. And then also for patients to realize, like, get a primary care that you trust, that you feel like you have a good rapport with, that know you when you come in, because that does make a huge difference in at least navigating the broken healthcare system that you may encounter.
You cannot use an urgent care as your primary care.
Yeah.
You can use an urgent care for the weekends when you have a UTI and your primary care is closed, or for after hours or things like that. Urgent cares exist for a number of excellent reasons.
And we're thankful for them.
You cut your arm, you need it sewn up, you should pop right in there. And we are so thankful for them. But there are too many stories of that recurrent fever in a kid, and they went to this urgent care and it was diagnosed as a upper respiratory infection. They went to this urgent care and it was diagnosed as some other kid infection, and then there was no continuity and it was cancer.
Yeah.
Because recurrent fevers are sometimes bad things.
Yeah.
But if I'm seeing you for the same thing over and over, I start going, why didn't you get better?
Yeah.
What's going on here? I can put together all the pieces because I have all the pieces. You can't have the pieces spread everywhere.
Yeah.
Things get missed, and you need someone who, like you said, is going to advocate for you. You need someone who knows you well, who knows your family, who sits and talks about stuff besides just the fever.
Yeah.
You know, when you come into an urgent care with a fever, they're dealing with fever.
Yeah.
And we need to deal with all of it. So yeah, I think that's an excellent one. That's not even one that I had thought of in my laundry list of things broken in the healthcare system. But we devalue primary care. As a doctor, I came through training for med school with the devalue of primary care. I will not forget the people who asked me, my fellow medical students, what I was going to do. I always wanted to be a family medicine doctor. And I also had a degree in anatomy, and they were like, you're not going to be a surgeon? And that's obvious because I was good at anatomy. They thought I'd be a surgeon. But then they would be like, you're way too smart to do primary care. And I was like, what in the holy world are you talking about? So primary care has to know all of it.
Yeah.
All of it. You better be really smart. Like if you specialize in the mitral valve, I don't feel like you have to be as smart as me. Yeah. No, we're all smart. We all have to be smart. But it's devalued even in training.
Yeah. Well, and I think too, like I had made a post just in general, like not with Our Family Health, but about death by suicide. And someone said, and I talked, if you're depressed, go see your primary care. And I had someone comment like, well, they don't listen to me. And I'm like, well, then find another one.
Yeah.
Like if you come in and you don't love us, or you don't feel like there's a connection, like there are other primary cares. Like, it sounds horrible. Shop around. Yeah. Like you don't have to come in
shop
every
around
time.
for a mechanic.
Yes.
You shop around for a hairdresser.
Yeah.
Yeah.
So if it's not someone that you feel like you are connected to, or that you feel like you are valued when you see them,
Or it's just not a fit.
Yes.
Not everybody.
I am not for everybody.
No,
I know that.
We are not for everybody. Amber's gonna yell at you if you don't do like you're supposed to. If you're
tough
sensitive,
love.
that could be a challenge. When you say even death by suicide, it makes me think one of the things when I was pulling from different what's broken in our healthcare system is we in the United States have the highest cost healthcare system with some of the lowest outcomes, and one of the lowest outcomes we have is death by suicide. We have low outcomes in morbidity and mortality in maternity and delivery. We have bad chronic disease management. We have a lot of chronic diseases, but our morbidity and mortality rates are high. And we cost the most.
Yeah.
So
it doesn't make sense.
We're not getting the bang for our buck.
Yeah.
We're spending money on things that don't make sense. Like we're spending money on things like defensive medicine. We're trying to not get sued. I learned more in medical training about how to avoid lawsuits than I learned about nutrition. And I needed to learn that. I don't fault the people who taught me. I in working with everybody here, am always like, if we got called to the stand, what would we say? What would we do? And so do we order CAT scans and MRIs at times to CYA, as we call it, cover your fill in the blank? Yeah, we order stuff for CYA.
Yeah. I'll tell patients sometimes, I need you to do this because it makes me feel better about my life for you. Like, this is probably not what it is, but it makes me anxious that it could be.
Yes. And now there is one thing where we're ruling out the bad stuff. And it is our job to rule out the bad stuff. So if I think you have a brain tumor, I'm going to get a brain MRI. But if I think I'm going to have to explain to a jury why I didn't order an MRI and that's why I order an MRI, I don't tend to go there that much. But we're trained that way. Yeah. We are a very medical legal society, and there is a cost to that. So we're putting cost to things in healthcare that are not the patient, that are not the best care, which brings me to my one thing that I would fix. It's an easy one for me. I would fix the insurance companies, and I am choosing to not cuss before I say insurance companies. I have said many times, if you see burnt down buildings of insurance companies, it might be the medical community who did it. It is not only frustrating for the doctors and the medical providers, it is frustrating for the patients. There is one huge benefit for what's going on with insurance, and that is the financial gain of the insurance companies. Somebody has to govern insurance companies. I say every day in some fashion or another, somebody has to govern insurance companies. Someone has to stop the fact that this massively for profit for insurance is hurting doctors and hurting patients. I have a patient who's in kidney failure because it took us 3 weeks to get a CT scan approved. She had a kidney stone. She is a young person in kidney failure, and we could not diagnose and treat a kidney stone because the insurance company would not let us get a CT scan. And I made 3 phone calls, stopped seeing patients, and called the doctor at the insurance company to justify the CT scan on 3 different days. The first day, the person wasn't available at the insurance company, so I held for a prolonged period of time while my patients waited for me. And then the second day, I talked to someone, took them through the whole thing. Well, I wasn't talking to the right person who does CT scan approvals. So finally, on the 3rd day, then they took a week. I talked to the right person. They take a week to approve it. Well, if you have an obstructing kidney stone for 3 weeks, that urine has backed up those toxins into your kidney for 3 weeks, your kidney's not going to recover.
And often I don't ever mind doing them for patients. I will put a block on my schedule and do them. But
I mind doing them.
You mind doing them?
Not for the patient. The patient didn't create this system. I mind doing them because the insurance company is simply creating a barrier for that person getting timely care so that they can try to not give the care.
Well, often what I'll say to them, little passive aggressive, that's my personality. I'm like, well, did you read the note?
Yeah.
Because it's in my note.
Yes.
And they didn't read my note. And I'm like, I have just held or talked to somebody for 30 minutes going through all the obstacles, and it is I already
sent you all this information.
Are you kidding me right now?
But they just have a reflex that says, well, this requires a phone call or prior authorizations for medicines. And we always end up kind of being made the bad guy because someone can't get the medicine that we prescribed.
And the patients will say, well, just do the PA. And I'm like, And patient, that no fault to them. They have no idea
No
what
fault
that
to them.
entails.
They don't understand.
They don't know. They're like, oh, well, you can just do this PA. And I'm like, well, your insurance is never going to approve this medication because it is not they don't want to approve the medication.
Exactly.
I can write, I mean, I've had patients bring in paperwork that I've done appeals for, where I have written letters, and it is just absolutely impossible.
And the PAs, just so that people have an idea, the prior authorizations typically have very ridiculous steps that the insurance company has said. So let's say I want to get you an antidepressant and you have not done well on this one, and I really feel like this is going to be the one for you, and you're desperate and you're not doing well. I don't want to fail two more. We've already failed one, had pretty significant side effects. In my mind, I've said, I don't think SSRIs are going to be the answer. I'd like to jump to this newer medicine. And they have a very specific, you must fail 3 medicines before we will give you that
30 days
one.
apiece.
Yes.
So we're looking at
and
3
you have to go
months and
fill
delay.
them. And and so in 90 days, I can prove that you failed 3 medicines. And I'm really now wondering if we're going to become suicidal in the next weeks, and I'm nervous. And insurance companies will cost themselves more money by now I have to have an inpatient stay in a psych ward because you denied the medicine so many times.
Yeah.
I just recently had a family member who was having shortness of breath, and we thought we better rule out a pulmonary embolus. And I only know this happened because I was the family member who was trying to care for them. And we attempted to get a stat CT scan of their chest to rule out a blood clot in their lungs.
Which would ultimately kill them.
Which would kill them and so it got approved the insurance company approved it for an imaging center 45 minutes from us. Thank goodness we have the ability to do that. Some of our older patients can't drive 45 minutes somewhere. And it got approved for 4 days later. And so knowing what I know, I said, well, if your O2 sats drop or if these things happen, I'll take you to the emergency room and we'll get the CT scan as we need to. And gratefully, we figured out other things and we ended up not having to go down that road. But you would have been dead if you had a pulmonary embolus by the time that we could have got
to the ER.
that.
The cost of an ER visit
And
versus
so what has the
CT.
insurance company done? They've actually run up the cost of health care by denying and we frequently will try to keep people out of the ER.
Yeah.
One of our nurse practitioners has many years experience in the ER, and I was talking to her yesterday, and she's like, I hope I'm not sending too many people to the ER, but I know these sick people and they're getting admitted. I said, you're not at all. And she said, I'd like to keep people out of the ER. And I said, well, sometimes you can't because you're not going to be able to get that stat scan. If we could get your head scanned right away, we could keep you out of the ER, but we can't get it approved. Now, the hospital would take you, they'd get the scan done, but the insurance won't approve paying it, and that takes like 4 days.
Yeah.
And if I think you're having a stroke, I can't hurry up and do that. So what do we have to do? Yes, send you, right in and get the scan through the ER because that's the only way it gets done in a stat way. Yeah, so I believe that we need to govern insurance companies. I believe that insurance companies need to remember that they are supposed to be helping take care of people and that the profit margin should not be their central focus. There are more barriers. We are losing good doctors every day because insurance companies are running them out of practice.
Yeah. And I can speak for our clinic. I don't know about everybody else's, but I don't feel like we order a lot of unnecessary things because I talk to patients about that. Like, I don't like unnecessary medical bills or surprise medical bills. So I will often tell patients like, hey, this is what I'm concerned about. These are the steps that we need to do to either make this more cost efficient, or you may have to pay $120 for this lab because I know it is not covered, but I really feel like you need it.
Yes.
So that's also where my thing back to primary care, like these are conversations that you can have with someone that you trust, but I don't feel like we're just like, here's a free for all, go get an entire body scan.
And
like,
I think most of the good clinicians who are feeling like they're getting run out of medicine feel the same.
Yeah.
You have to call someone at the insurance company and tell them why you ordered the test. The answer is always the same, because they need it.
Well, and
because
they're sitting in
I
front
went
of
to
you.
school for a really long time. I took their history. I did their physical, and I need to rule this out because it could be a really bad thing if we don't.
Yeah.
That's why I ordered the test.
Yes.
It's, not because I feel like the people at the hospital don't make enough money on their MRI machine.
Yeah.
Come on. And it becomes so frustrating having to justify why you've done things. You've done things because you think it's in the patient's best interest. Yeah. Which brings me to, I've said a couple times now, insurance companies are running good doctors out of the business. Another thing that's broken in our healthcare system is we are understaffed. We are hugely understaffed. I don't know if the country realizes what crisis we are on the brink of.
Which for us, like when I heard this 23 years ago, which is crazy to me. Thinking, because now I've been in medicine now in some sort of capacity for 23 years, and we were short then.
Yeah.
And the baby boomers had not gotten into where the baby boomers are now.
Yes.
So now we
have more patients than we
way
ever
more
had.
patients.
And then came a pandemic.
Yeah.
And if you were already frustrated with insurance, frustrated with the fact that you had too many barriers to helping people, frustrated with another really broken thing in our healthcare system, that you're on this hamster wheel running as fast as you can to see patients as fast as you can, because insurance companies have created I need to do a referral. I need to get a PA. I need to do all these other things. And so the average amount of staff that it takes for one clinician is 5 staff members. So we have 10 providers, that's 50 staff members we have to fund. Well, insurance doesn't pay us anymore, so you have to see more patients. So you end up having this limited time with patients. So providers were already, I don't get enough time with my patients. I don't like all these obstacles. And then came a pandemic. And if you were on the fence of thinking that you might not want to do this job, the working in the hospital while you're taking person after person off the vent was enough. Yeah. And so the number is shortage of 124,000 physicians in the next 10 years. You can't build a physician overnight. And so we've got to get on this now. We've got to increase the number of kids that we are letting into med schools. We have got to increase the number of funded residency spots. There have the leaders that be have got to get on this. And then even more striking, 1.2 million nurses will be needed by 2030.
And that's not that far away when you think about it.
It is not. And if we start building them now, it's going to take us 4 years to create one.
Yeah.
And that's if the person is ready to go now. So we've got to open nursing spots. How many good people do we know that are going to be fabulous nurses who can't get into nursing school because there's just not enough spots? We've got to fix our system to be able to start preparing for this. And if you are listening to this and you're feeling frustrated because the next new patient appointment at your local primary care was 6 months out, it's not true for us. It's true for a lot of places. It's going to get worse. Mm-hmm. You're not going to. I have a patient who drives from Alabama to see us. She's a Medicare patient, and within an hour of her home, she cannot find a primary care doctor who accepts Medicare. Not just one that's on a wait list, but one that accepts Medicare at all. Yeah. And her daughter drives her over to us 3 hours, which is a wonderful thing that she has that option. But it worries me for navigating her care. For us here, navigating our care in Alabama. Yeah. So there are, we could go on and on mm-hmm. and on about we don't have enough time to take care of the patients. The insurance has too much control over what's happening for the patient and for the doctor. We have a fragmented system where the people in the hospital aren't talking to the outpatient doctors, who aren't able to talk to the specialists, who aren't able to talk to the patient. And the communication's not what it needs to be. There's a lot of things that we need to start trying to make steps in the right direction. I think first we need to recognize that this is an issue. We need to really, all of us need to recognize that this should be one of the things that we vote based on. What is your local representative going to do for your healthcare system? Mm-hmm. It's huge. Yeah. It may not be a big deal to you until you need it, and then it's literally life or death.
Yeah, and you were just mentioning communication between healthcare, and I feel like, thankfully, within our practice and within this area, we have established good relationships with other specialists. Like if I am super worried about a patient, I can pick up my cell phone and call several of the
Our
physicians
specialists are so incredible. So many people who
love
our
and care
listeners
for
have met through the
people's-
podcast.
Yes.
We call them and they say, I'll see him today. I'll see him today.
But that's not the case in a lot of places.
These relationships don't exist like they used to when
Yeah.
doctors round in the hospital and they all would,
Powwow
meet in the
together,
physician's
yeah.
lounge. And those relationships, you have to put energy into
Yeah.
making sure that they exist now.
So I feel like that's one good thing that I think we can offer patients, but that is definitely not the norm.
Yeah.
Is for patients to be able to say, like, I had a patient who I saw, I was super concerned. I knew he was going to need multiple specialists very quickly. And so I had the GI, I had the oncology, I had the surgeon in my phone.
Without a 2-month wait.
Without
Yeah,
a 2-month
you
wait,
could
and
call
said,
and they would work
hey,
'em
can
in.
you please work them in within the next week? And they were all more than willing to. And so, not that it's always about who you know, but in a small town, in our type of area, like
We are blessed with
we
that.
are so blessed to be able to offer that to patients. And I don't think they realize how significant that is.
Well, when you're sitting home sick, waiting 3 weeks for the doctor's appointment, then you
it's
realize.
stressful.
Yeah.
So, but yeah, communication between providers, I feel like, is also something that's a little bit broken, which we try to bridge that gap, but that's, I know, not always the case. Not that people don't want to, it's just almost impossible.
Yeah. So I feel like this was therapy for us in that we got to vent about the things that do indeed drive us crazy about the jobs that we love.
Yes.
When you want to help people, you just don't want barriers to helping people. And cost and insurance companies and access are barriers to helping people. And I know that I love our country. I've worn a uniform for this country. I know we can do better. We have to all be focused on putting energy toward doing better.
I was going to say, like, what if listeners are like, oh, we are right there with you. Like, what can we do? And, to kind of help or navigate even for themselves. And what would you say to that? I was thinking, like, get a good primary care. Find somebody you trust.
Get a good primary care. Try to understand the insurance system so that you can navigate it, because sometimes we don't get to make the game. We just have to play the game.
And we also mentioned we had a insurance podcast several episodes back that they could reference about kind of how to navigate, like, cost for your medications and what does this actually mean.
And you can look into that
and
more.
Understanding what you actually have,
and think about what you vote for and how you vote for it, because we have to keep healthcare as a really important thing in what we're legislating. We have to continue. The Affordable Care Act offered more resources. We have to keep pushing. Healthcare should always be something that we're talking about. How do we improve it in this country? There are things we can do, and I think first and foremost, we have to recognize that we need to do things. Thanks so much for joining us today, and we will try to not rant on too many future episodes, but we appreciate you listening to this rant, and we hope that there's a takeaway.
We like to end you on a good note. Today's Tell Me Something Good is, and this is appropriate,
our Wellness Center.
Woohoo!
Our Wellness Center has been a long time in the making. We are so excited about what we can do to help people through our Wellness Center, and it is coming soon. Please come visit us in our Wellness Center. It is definitely something good. Thank you for joining us today, and until next time, take care of yourself.